Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I'm Hope, and I'm your host.
And I'm Chelsea. I'm the co-host today. And then for our provider, we have Dr. Hutchinson on with us today.
We have a special bond with Dr. Hutchinson, so we basically forced him to come on and be on here today, but we're grateful to have him. So I'm going to give him the opportunity to tell us a little bit about himself.
I'm Dr. Hutchinson. I've been with Tanner Clinic for going on 10 years now.
Old.
Time flies.
I'm just kidding.
Yep. I did my undergrad here in Utah and then med school in Michigan and then residency in California.
We are going to get started with our new segment we like to call, Is This Doc Normal? And my first question for you is, no, I don't think you are either. My first question for you is, who is your favorite fictional doctor?
Favorite fictional doctor?
Yeah, real life doctors, I don't know them, most of them, probably.
Anyways. Like TV doctor?
Yeah.
We're going to go with Dr. Cox from Scrubs.
What? All the doctors be loving Scrubs. And you know what?
Yeah.
We were talking about it, and someone said that Scrubs was like a really accurate show.
To some degree.
Okay.
Yeah, to some degree. Medicine isn't quite as cool and as sexy as it might look like.
In that show, that show's not like a great example of like medicine being like sexy because they're just idiots the whole time. But
it's not as funny either, but it's a good show. Yeah, a lot of stuff is accurate.
Well, a lot of Scrubs shout outs on here. So I guess go watch it. I don't know.
Okay, next question. Who is your celebrity crush?
Celebrity crush.
Burning question.
We're going to say Jennifer Aniston.
That's a good one. Yeah. I feel like that's a lot of people's.
Is it?
I feel like it.
She's a classic.
Yeah.
My generation.
Yeah.
I'm not going to lie. We put that question in because we thought you were going to say someone else. Because we have a little bit of an inside joke with him, but we will accept.
Thought I was going to say what?
Anne Hathaway.
Yeah.
She works too.
Yeah. What do you like to do in your free time besides pranking the marketing team?
Pranking the marketing team is my favorite for sure. All kinds of stuff. I'm recently into making pizza.
Notice how he said that? He picks up a new hobby like every day.
Something new all the time. Yeah.
He's always doing something.
Yeah, I'm always tinkering with something. Up until recently, I kept a couple of beehives, which is kind of a fun thing that I do as well. Movies, hang out with the kids.
We're constantly sharing movies to each other.
Movie quotes.
Yeah, and he'll be like, have you seen this movie? And if I haven't, he like wants me to watch it and vice versa.
Are you still doing your sourdough? Because you had a sourdough starter in the clinic for a while.
We've kind of transitioned a little bit to pizza, but yeah, still doing sourdough.
So you turned the sourdough hobby into pizza dough hobby?
I have yet to cross that.
Oh, okay.
Cross into that. That's coming though. That'll be there. Yep.
What about your fish?
So I haven't kept fish in a while. That's one of my other things that I've done and then haven't done. And then
I'm just trying to give these guys a little bit of a hint of who you are.
Yeah.
These are all hobbies.
Some people claim that I'm ADHD, that my interests bounce around, and that's true. It's been a few years since I've had fish, but yeah, I've kept some saltwater fish, which is actually fun and an easy hobby too. So,
would you rather be in a rom-com with your enemies or in a horror movie with your best friends?
Oh man! If we're putting me in a movie, then we are running out of options. I think I'd rather be in a horror movie with my friends.
That's what I said.
That's what
nobody dies.
This is what I was thinking. If you trust your friends enough to survive, like if you think your friends together are smart enough to survive a horror movie, like you wouldn't fall into all the tropes.
We're in big trouble.
But like, don't answer don't just be dumb. Lock your doors, lock your windows.
Don't go down the creepy stairs.
The creepy stairs, like
by yourself.
Don't go into like a shed with like a chainsaw in it or whatever. Don't do stupid stuff.
I think we're still probably in trouble, but
But at least you die with your friends.
That's right. At least we'll
Yeah.
all be in it together.
Yeah.
Yeah.
It'll be more fun that way.
I don't know. I think a rom-com with your enemies could be funny though too, because it's like the enemies to lovers trope.
I feel like it depends on who your enemies are.
I don't know if I have any enemies. That might be hard too.
Right.
Yeah.
At least none you want to
I
call
don't like
out.
hate anyone enough to call them my enemy.
I
really.
know.
I think in conclusion, I would have to say you are pretty normal, actually.
Okay. I appreciate that.
Even though I really want to say that you're not normal, but
And I would understand if you said that too.
yeah. So we're gonna get on to today's topic, which is vaccines. That's a big thing that you deal with every day as a pediatrician and something that a lot of parents have questions about. So that's going to be our topic for today. We're going to get started with the basics of vaccines. The first question that I have for you is, are vaccines safe for my child?
Okay. That's a great.
We're going to get
question.
started. We're going to ease into the topic.
Let's go right into it.
Yeah.
So for the vast majority of children, yes, vaccines are safe and protective and important. Obviously, not every single child is exactly the same. There are some children that can get vaccinated for one reason or another. They may be immune suppressed or whatnot, and vaccines actually don't really work for them. Like, they don't mount an immune response. And so those are kids that we typically don't vaccinate. Those are pretty rare. There are people that are allergic to vaccines, and just like any kind of other medication, if you're allergic to it, you don't take that medicine. Those are fairly rare as well.
Mm-hmm.
But for the vast majority of children, yes, vaccines are safe.
So just going into a little bit more about vaccines, how new are vaccines, and are there new vaccines that are being added or being like created?
As far as humankind goes, vaccines are pretty new. As far as like a person's lifetime, then vaccines are actually not so new. So the first vaccine that was developed was for smallpox, and that was actually, I believe, in the late 1700s. So
Really? That early?
It's been a while since then.
Learn new things every day.
So if you look at it like that, the last couple hundred years or so, pretty new as far as mankind goes. But we've had vaccines around for many generations. As far as new vaccines go, every once in a while, something will be added. As far as substantial vaccines added to the schedule that we use now, there was a meningococcal B vaccine, which is a vaccine for meningitis that was added, probably 10 years ago. And there were a couple of tweaks kind of in the early 2000s to the vaccine schedule that we use today. But outside of that, vaccines have kind of been, the schedule's been essentially the same since like the late 90s.
And I obviously know you're not like the one creating the vaccines, but is it the way they go about making them pretty like similar?
So there are different techniques that you can use to create a vaccine. The mRNA vaccine is a newer technology that kind of the first thing that we saw with the mRNA would be the COVID vaccines. Outside of that, there's a couple of other different ways that you can create a vaccine. You can take a really horrible virus and kind of injure it. Mm-hmm. So it's what we call a live attenuated vaccine. So you essentially take the live vaccine, but you make it so it can't replicate for one reason or another, or it has a difficult time replicating in your body. That's a method. Or you can take like segments of a virus or a bacteria. So not a full pathogen, but little, what we call antigens, little segments of that pathogen, and then introduce that into the body and get the immune system to react just to those antigens. You can make a vaccine in that way too. So those are kind of the methods that we use. For the most part, those are the methods that we use for vaccines.
I feel like this is a question that a lot of parents have. Do my kids really need to be vaccinated for things that like we don't even see anymore?
So that's a great question, and that's kind of a question that a lot of parents ask me. Odds of getting something is really rare, which is true. The odds of getting polio is low. Unfortunately, it's not zero. Yeah. And we live in a worldwide community, especially now. So if somebody comes from China, they don't know that they have polio. They come from Afghanistan, which is still endemic in some parts of the world. They don't know that they're infected, and they come to the United States to tour. They come to Disneyland. Mm-hmm. And Disneyland, they walk all over Disneyland for a couple of days, and then everybody who's at Disneyland flies home and to their different parts of the country and whatnot, and they don't know that they've been exposed, and then, can potentially expose other people too.
Yeah.
So the risk for vaccines is very low. The risk for contracting a serious disease is low, but the risks of serious problems with that disease typically are high.
Yeah.
Like the odds of getting polio, if you get polio, the odds of having a bad outcome is very, very high. So that's why we vaccinate still for things like that. For, say, smallpox. Smallpox is a horrible disease, but we have rid the world essentially of smallpox, and we don't vaccinate for it anymore because of that.
In my mind, also, I'm thinking like if more people don't get vaccinated or whatever, that's more people that could potentially like get it and spread it to other people.
Yes.
So
And that is one of the things that we've dealt with, especially over the last 20 years or so, because there have been fears of vaccines for many different reasons. And so vaccination rates have decreased a little bit, and then we kind of hit this threshold, which we have hit, where, if everybody's vaccinated, except for the ones that can't be vaccinated, nobody gets sick. Even the ones that can't be vaccinated, because the disease is just not in the community.
yeah.
As that number decreases, the risk goes up, and that's where we're at now.
Yeah.
What vaccines are the most important ones to give your child?
Okay, that's actually a question that I get a lot too. So we'll get parents that kind of along our discussion, some things are really, really rare. I want to vaccinate. I'm not against vaccines, but I don't want to do anything that's not necessary. The vaccination schedule that we come out with is not an accident. We vaccinate against the worst things, the worst diseases that we're able to vaccinate against. That's kind of a hard question to answer, because the answer for that is the most important things to vaccinate against are the things that you want your child to be protected against. And the answer to that is kind of everything that they could get, we would like to protect against. Some things that are super rare, kind of like we talked about, kind of polio that's rare, but still horrible. So we want to be protected against that. Things like the pneumococcus bacteria, which can cause really nasty recurrent infections and whatnot. It might not necessarily kill you, but it could, but it can cause recurrent ear infections. It can cause meningitis and cause just infections over and over. So we want protection against that. The answer to the most important vaccines are kind of all of them.
Yeah. So there's not like one
Yeah.
or that you'd place over the other ones. You're just saying like if
I deal with that every day, because I have parents that they want to vaccinate, but they don't want to give all the vaccines. So we kind of have to pick and choose, and we kind of use that logic. Like, all right, so, this vaccine A is against something that's a little bit more common in our area, so maybe we can start with that. But I would recommend the CDC vaccination schedule the way it stands now.
yeah.
And I would say that all of them are important.
Yeah.
I'd agree.
I would also
Like,
agree,
it's-
but
Becoming a new mom, like I'd agree that
Right.
all of them are important in their own little way.
And we totally understand, especially in our day and age, with lots of social media, with lots of voices that are louder and louder every single day. I understand the pressures and the worries, especially the new mom. It is an interesting time to be alive right now. It's an interesting
Yeah.
time to bring a baby into the world. A wonderful time and a scary time altogether. So I understand where parents are coming from and some hesitation that's there. So it's good to have a great relationship with your pediatrician and,
Yeah.
and to feel comfortable about talking about these things.
yeah.
Why is Hep B given so early? Is it an STD?
So a lot of people ask me that. And the answer is kind of. So hepatitis B is transmitted via sexual contact or blood exchange. So like dirty needles or whatnot, things that babies don't do. But it also very frequent way to transmit hepatitis B is from mother to baby.
Okay.
And so a lot of moms say, well, I don't have hepatitis B, and that is great. I'm glad that you don't have hepatitis B. From a community standpoint, from across the United States, countrywide policy, I guarantee you that there's a mom that gave hepatitis B to their baby absolutely unintentionally. No, she didn't know that she had hepatitis B. And the risk is the highest. The younger you are, the more risk you have of becoming a chronic carrier of hepatitis B, exponentially high. So the highest possible risk that you have of contracting hepatitis B and being a lifelong carrier is the day that you're born. And so we give hepatitis B vaccine the day that you're born.
Okay.
It's a safe vaccine, and I know parents say, all right, it's safe, but why do we need to give the vaccine to a baby if it's an STD? Yes, it's an STD, but it's also, that is not the only way that you can get it. And definitely, if you contract it when you're an infant, you're going to end up very likely dealing with it for your entire life. So that's why we give it so early.
Makes sense.
I'm also of the opinion, and correct me if I'm wrong, but like you don't always know how your child is going to be when they get older.
That is correct.
So,
Yeah.
So
you have the best intentions for your child. You think
absolutely.
they're going to be an angel. They're never going to
break any
rules or whatever, but
right.
kids sometimes
And
turn out
and that's
differently than
true.
that.
So hepatitis B can be transmitted sexually, and then HPV, which is another vaccine that we give, that the majority of that is transmitted sexually, and HPV can cause cervical cancer, penile cancer, head and neck cancer. Those are typically the cancers that are caused by the human papillomavirus. And people grow up different. People have different opinions. And even worse, sometimes, the decisions that you make aren't necessarily made by you. Sometimes things are not necessarily consensual, I guess is what I'm saying.
Yeah.
And it would be horrible to, in addition to dealing with that, have to also deal with, an STI exposure and then contracting a virus. If you get HPV, you'll have it for your life. And it's not just necessarily, and let me back up and say, it's not just necessarily protective against people who are sexually promiscuous. For instance, it's protective, and you never know who you're going to marry. Like, and you don't know how your kids are going to grow up. You don't know how your kids' spouses are going to grow up. I'm not saying that they're bad people, even if they were, a little rebellious or a little, choose a different lifestyle than what you would necessarily choose for them. Which is every kid, by the way.
Yes.
Every kid has that. But that doesn't mean that they're going to necessarily be sexually promiscuous or whatnot. If they are, or if their spouse is, that can change. The day you meet your spouse, you can completely become a different person and live a different lifestyle. But it would be unfortunate to have to deal with that and then have your spouse deal with that later on. Because of things that happened to you in your childhood.
Yeah.
For sure.
Can a child get a vaccine if they are sick?
Yeah, so kids can get vaccinated when they're sick. Every once in a while, we'll have a kid come in, and sometimes parents don't want to do it when they're sick. And they'll ask, is it safe? And yes, it's safe. In fact, their immune system might be already kind of ramping up, and they will respond great to the vaccine. They'll process it and build immunity to that. It's not going to help them feel any better. So I'll have a lot of parents that, little Timmy's sick and I don't want to vaccinate, and that's fine if we want to hold off until they feel better. I have the policy, if we don't want to vaccinate right now, that's fine. Just come in sometime. Vaccines take 5 minutes and you caught up and whatnot. So yes, they can get vaccinated if they're sick. As long as parents are comfortable with that, and as long as, sometimes you might get a little bit of a fever, you might feel a little icky after a vaccine. If they're already kind of feeling icky, we got to keep that in mind too.
This is obviously a very complex topic, so we are going to make this into a 2-part series on vaccines. This first episode, we got into a little bit about the basics, like how old vaccines are, what you suggest as far as what are the most important vaccines, aka all of them. So we just basically got into the basics today. Look out for our next episode where we'll get more into details about more of the specifics on vaccines, but I think we did learn quite a bit today already. I think Chelsea probably would say she learned a lot. She's going to be a new mom here soon. So this is a good topic for her, I think.
Yes, it's a very good topic. I think even if you already are a parent, just to make sure that you are educated, whether you haven't had a pediatrician educate you or you haven't looked into any research yourself, I think it's a very good topic.
Look forward to the next episode. You can follow us on our Tanner Clinic social medias, and we'll be posting updates on that. So look out for that, and we will see you next time.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider.